We're going to talk about cheek and chin enhancement with cheek and chin implants. Let's first talk about chin augmentation with a chin implant. I want to first talk about some of the aesthetic elements, the preoperative consultation, talk about exactly what I do surgically and your recovery time afterwards. Let's first talk about who is a candidate for having a chin implant. It is important during the physical examination that I evaluate exactly the bony structure, soft tissue structure of your chin, but also look at that chin in balance with the rest of your face. The facial structure, such as the cheeks, the nose, and all those areas are very important to evaluate. Oftentimes, in order to better communicate with you, I will use digital morphing technology in order to show you on a computer exactly a simulated result with the chin implant. I will use sizers, different sizes, in order to get an assessment exactly what size would be appropriate for your face. The needs and requirements for men versus women are quite different. For women, I tend to undershoot a bit. It is better to have a slightly smaller chin than what a male would want in that same facial shape. For a male, it oftentimes is better to be just about at the mark or maybe even slightly overshoot for the chin in terms of getting a very good aesthetic result. In terms of some of the preoperative considerations I look for when I evaluate you, those would be, for example, besides how all the face works together, is also your dental structure. When I'm evaluating the chin, what's so important to me is making sure that your dental positions are good. For example, if you have a significant overbite, it may be better for you at least to seek orthodontic consultations, that is, consultations with specialists who can either advance the jawbone or realign the dental teeth before I start talking to you about chin augmentation. Chin augmentation is one of the subjects that really does help you significantly in overall achieving a better facial balance. The type of chin implant that I use is what I call an extended anatomic. An extended anatomic chin implant is one that tends to taper out toward the sides right here so that you really barely feel or not feel at all the edges of the implant. It's placed just above the bony lining so that it is able to really be so deep that you barely can feel it and you really should not even see it. It's placed along the jaw line itself here. So I really like to use the term jawline enhancement more than chin enhancement because the old button style implants that were very small and abbreviated that just basically rested here, in my opinion, are outdated for the following reasons. First of all, when you have a chin deficiency, oftentimes augmentation of the entire jawline provides a much more seamless and much more natural result than you could otherwise have with a button implant. Also, if you think about what has happened with button implants over time, there's been a real problem with them shifting. The way that I place the jawline implant is very important for you to understand, for the simple reason that it helps really enhance the solidity and preserve the position of the implant over the rest of your lifetime. It should never move or go away. The way that I do this is, first of all, there is a tiny incision below the chin. The reason I do that is a better access point for a longer type of implant that I'm talking about. The second reason is sterility. You don't want the implant to be infected, so I use an access external here. And the third reason is oftentimes people that have a small chin are also good candidates for a little bit of liposuction. So it's the same access point that I use to help you with a little bit extra fat in the neck if you do need that. In terms of the way that I place the chin implant in, this may be a bit more technical than you would like to know, but I think it's an important point to emphasize for a few reasons. I want you to understand why it's so important to do this and why I do it this way so that it can help you. I use a tiny pocket that goes underneath the lining of the bone on the outer portion here. In the central portion, I put it above the bone lining. Now that may sound very esoteric and arcane, and you may wonder, why am I talking about it? The reason is several things. One is the fact that sometimes an implant can cause a little bit of bone resorption. By placing it above the bony lining, I really think there's much less bony resorption of the chin and almost negligible or non-existent. The second reason that's so important is when you place the implant into the side pockets and place a different pocket on the central area, it allows you truly to have a solid implant that doesn't move because it's really placed into 3 planes. And that, again, is something I really want to emphasize in terms of how my technique is different. I close the skin through multiple little layers. That allows that implant to really stay in good position, and close the muscle layers below that to help allow the muscles to help hold that implant in position as well. Let's talk a little bit about your recovery time. The recovery time actually is quite small in most patients, and the reason being is that any degree of swelling, a little bit of chin enhancement already still looks pretty good because you were deficient to begin with. You had too small a chin, so a little bit of swelling is pretty well tolerated in most patients. Most of my patients, even within the first week, already look pretty good. Now, if I do a little bit of liposuction under the neck, there will be a wrap under the neck, a larger wrap for one night, which I take off the next day, no drains. And then I leave a light ace wrap, all of which I'll supply to you for the rest of that week. That little bit of a wrap under the neck really helps sort of scar up the tissues and allow that neck to sit where I want it to sit. The sutures come out at about day 10, and the reason I take a little longer than 7 days to remove it like I do for other sutures is that it takes just a little bit longer to heal under the neck. If you're a man, one of the major things to understand is that I have you not to shave for the first 2 weeks if possible, and if you can't handle that, you can even shorten that down to about 7 days, so long as at the end of 7 days you don't shave exactly in the suture line. That's important. And if you can use an electric razor for the next couple weeks, that will also be very beneficial. What I find in men, it's even less obvious, because if you wear a little stubble or a little bit of hair around the beard distribution, it camouflages any little bit of swelling you may have, and it makes that recovery period so much smaller. And it's already very small to begin with a chin augmentation. Those are some basics that I wanted to talk to you about in terms of a chin augmentation. Let's talk about cheek implants. I don't do as many cheek implants as a lot of doctors do for the simple reason I don't think is justified in a lot of patients. The problem with a cheek implant, in my opinion, is that especially if you're passing 30 years of age and you're getting a little hollowness around the lower eyelids, my concern is that if you put the implant in, that can also make the lower eyelid appear even more hollow. And then you, over time, as you get into the 40s and 50s, you start losing that, what I call the soft tissue envelope. That's the tissue that surrounds the implant to camouflage and hide that implant. And over time, you can lose a little bit of that soft tissue so that the implant becomes more visible over time. Those are the two major reasons why I don't prefer to do a lot of cheek implants unless you're much younger and you understand over time as you get hollow, you may need some fat grafting or something to camouflage the implant. Now, the time that I like to use an implant is in someone that is very athletic, very gaunt, that doesn't have very good donor fat supply, in which case I will use the implant to provide a support and foundation for the cheek, upon which I may do some fat grafting around the eyes and the implant as necessary. But for younger patients who really camouflage cheek implants well, I don't need to do any grafting, and the implants are the most assured way to help to get that projected chin that you're so desiring. Part of what I do is, again, sizing the implant. It is very hard to use digital morphing technology to show you a size of an implant. It's more easily attained by using sizers on your face and showing you exactly what cheek size would be beneficial. The other thing I can do to help sort of communicate better with you is to use a little bit of salt water into the cheek and just sort of giving you a projected idea of what that cheek implant will provide for you from an aesthetic level. The way that I do a cheek implant is that I use a micro incision really from inside the mouth. So that is important, so there's no external incisions when I do this. The reason I like that technique is that there really is no cutting in the central face, which in my opinion is more unforgiving. I put the implant really up underneath the lining of the bone, and it keeps the implant really into position. For a couple days you'll have a little bolster. That's a little suture I pass through the skin into the implant itself, which I remove about between 2 to 4 days after the procedure itself. The sutures I use inside the mouth are dissolvable, and those really dissolve over a period of a week. The recovery, again, is not significant. I've noticed that some of my patients over the first few days or so do have some swelling, but that tends to dissipate rather quickly. I hope that's a good primer for you in understanding when and how I use cheek and chin augmentation in my patients, and I look forward to meeting you when you come in for consultation.